Grazie Sean di avermi dato.
Thank you, Sean, for giving me the floor, because it is an honor for me to be here, and I would like to thank Professor Kress and the moderator. Our workshop, number 1, discussed what is the main topic, that is pain as a disease from all points of view. First of all, from the ethical and bioethical point of view, followed by many other situations such as research, physiopathology, etc. Sean spoke of education earlier and the importance that we attach to study groups that cooperate in order to influence on the political and insurance choices. And I would like to add that it is important to also educate doctors. And here I'm referring to what is happening in Italy. I am the secretary of the Italian Association for the Study of Pain, the Coaccioli Foundation, and we have launched a very widespread campaign in order to teach what is not taught during the university courses. Because up to a short time ago, pain was considered a silent disease, but a disease that over time, during the clinical life and over the years, it does have an influence on people's lives and therefore has very important consequences. As you can see, virtually all the organs and the whole of the human body is influenced in quite an important way by pain, especially if this pain is not treated. So you can see how, from the cardiovascular point of view, there is a greater demand for oxygen, and therefore there is a higher MI risk. For the respiratory system, there is less alveolar ventilation and therefore an increase of pneumonia cases. Yesterday during the workshop, we discussed that from the musculoskeletal point of view, there is a very high percentage of patients that suffer from rheumatic diseases, whether degenerative or inflammatory diseases, or low back pain, or fibromyalgia. Chronic pain can also bring other situations of pain, like a complex pain situation. So chronic pain can also modify some of the immunology and has a negative effect on the natural killer cells, which are lymphocytes, and other functions of these cells. But obviously, the main point, as Sean McDougall said, is the impact that chronic pain has on the person, so on the patient, because the patient is unable to carry out daily tasks, the quality of life suffers and loses in confidence. And we know today, thanks to the biochemical events, we know this leads to depression, and therefore this means a reduction in appetite, loss of weight, lesser social activities, and therefore isolation. So we consider that 15 million people that we estimate in Italy suffer from chronic pain, they go between 16 and 64 years of age, so during working life. This means, obviously, that the economic cost of chronic pain is not just related to the cost of medicines, but also the reduction in income generation by these people. As Sean said earlier, and I would like to repeat this, we see an increase of the average age in Italy, and therefore the older patients will be the ones that will suffer from chronic pain, and this becomes a very complex picture because the patient will suffer from multiple diseases and therefore will be subject to multiple treatment, and this needs to be taken into account. Therefore, pain must be considered a disease in its own right, because it is the consequence of a series of pathological changes that we understand better today, and therefore has very serious consequences on the life of the patient. From the clinical point of view, the discussion centered on clinical topics relating to pain. And here you see the three main elements: pain in relation to chronic diseases, the new classification for pain, considered the fifth vital sign. So we need to make a big effort to ensure that patients that suffer from chronic pain and have a reduced quality of life means that we have to make all the efforts to convince the authorities and the regulatory bodies to change the paradigm, because the patient that has suffered has already been subject to a change, because his life has been completely placed upside down because of pain. So all the stakeholders, all the authorities, all the bodies need to make an effort to change the situation. Not so much because chronic pain has a very heavy economic consequence, but only if there will be good cooperation between doctors, researchers, insurance company, patients association, we will be able to obtain good results. Something that I found quite shocking yesterday is the fact that I saw that the new classification, ICD-11, does not yet foresee chronic pain in a very specific and dedicated position. And this is a major issue, because the fact that chronic pain is not considered like any other disease, I think, for instance, of the example of hypertension, that is not a disease, it's a risk factor, but is considered a disease. Hyperglycemia is not a disease, is a risk factor, but it is diabetes. So as SIP or as other bodies, we need to do everything we can so that WHO can look at this aspect from an ethical point of view and can change the situation. Measuring pain, and so we're going back to the most practical and clinical aspect, is a duty that doctors and patients need to undertake, because it's very important to report the level of pain that the patient is complaining about. And from a clinical, scientific and ethical point of view, it is very important that the doctor reports exactly what is being done in order to alleviate the chronic pain, because we must not simply cure, we must care for our patients. And yesterday we discussed the psychological consequences and the psychosocial consequences of pain. So pain is not simply an unpleasant sensation, as it is classified, but is also a sensation that has important psychological and biosocial consequences. I think I should now give the floor back to Sean. Thank you.